and then so it'll be DOCC, and then we'll be able to.
Oh.
I'll just go to a regular web page or Google,
Oh, okay.
and then the three little, or the 9 dots and the, yeah, go to me. And then type BOCC. Okay.
And then present?
Mhm.
Okay.
All right. So we will, sorry, convene as the Rio Blanco County Board of Health at 12:12. What did I do?
I don't know.
Thank you, Ms. Beck, for getting
Yeah,
lunch.
thank you, Ms. Vicky.
I feel like Grubhub. I think it's my next career choice.
Is that?
Yeah. I like the surprise too.
You have to have like all your routes laid out, that you know.
I think I could use a county car for that.
Yeah.
The question I have is, did you stop by Dollar General?
No,
Okay.
I was tempted, but I wouldn't want to deprive you of the option.
Thank you. I was looking forward to that.
There you go.
Well, I gotta be able to see my notes, and I don't know what I'm doing wrong there.
You click on top of them, I think.
I thought it was reading view.
Yeah, keep moving. There you go.
Oh. Well, you don't know how I did that, do you? I don't remember either.
At the bottom.
I thought it was that one. No, it's not showing one now. No, it's not. Did you try to use it? I think it's. Wait, wait. Show. Well, that's a count, it's just like this.
It almost seems like.
I don't.
Mm-hmm. If you're gonna do it.
Okay, sorry guys, I'm gonna have to just do it like this.
Mm-hmm.
Okay. Since we have new commissioners and I myself am new as well, I thought I would do an overview of public health and what we do as a local public health agency. So core public health services, under the foundational capabilities, we do assessment and planning. The public system will monitor, diagnose, and investigate health problems and hazards in the community, including public health emergencies, outbreaks, and epidemics, and will collect and analyze data. Communications, public communication will increase the visibility and understanding of public health issues and the value of public health initiatives through consistent strategic communications. Policy development and support. Public health policies will aim to eliminate health disparities, reduce death and disability, and improve environmental quality and health outcomes for all people. Partnerships. Public health system will engage community members and cross-sectoral partners, agencies, and organizations to achieve public health goals. Organizational competencies. We maintain accountability, performance management, and quality improvement to create a system that provides high-quality public health services. Emergency preparedness and support. With the help of other local public health agencies, public health system will have the capability and capacity to prepare for, respond to, and recover from emergencies with health and environmental and medical impacts. And then health equity and social determinants of health. Public health agency will collect, analyze, and report data on the social and environmental determinants of health to better understand the health of our community and to implement necessary improvements. So then we're on to the foundational services. Communicable disease prevention, investigation, and control. So this is carrying out state and locally coordinated surveillance, disease investigation, laboratory testing, and prevention and control strategies to monitor and reduce the incidence and transmission of communicable diseases. Environmental public health. This is participation in the protection and improvement of air quality, water, land, and food safety by identifying, investigating, and responding to community environmental health concerns. We also do maternal, child, adolescent, and family health. This is identifying and providing information and advocating for needed initiatives, which includes our WIC program. Chronic disease and injury prevention and behavioral health promotion. So this, we use policies and environmental change strategies to advance health equity, such as nutrition, physical activity, oral health, access to care, and disease management, injury prevention, violence prevention, suicide prevention, mental health, and substance use prevention. And the last one is access to linkage with healthcare. So this is assisting in providing access to personal healthcare services, including primary care, maternal and child health care, oral care, specialty care, and mental health care. So public health practice, this is more of what we do on a day-to-day basis. So promoting health of our community with utilization of science-based strategies to promote the health of the community, preventing disease, injury, and premature death, responding to environmental threats and emergencies that could impact human health. Community health status is regularly assessed and plans are made to improve the health of our community. Infectious diseases are monitored and investigated to prevent their spread. Children and adults have the opportunity to be vaccinated against disease. And screening programs are available for early identification of chronic disease. This is just continuing. Reproductive health services are available to our community. Ensuring healthcare services are available to all populations within our community. Emergency response plans are in place for disasters. That's what we're working on right now. Drinking water is safe for our community. Air is healthy. Sewage is contained, and restaurants serve safe and untainted food. So this is just some legislation that I researched, and I took a training of the Board of Health training for Colorado. So Colorado Public Health Act of 2008 intended to improve performance of the public health system statewide. And the General Assembly declared that public health reduces healthcare costs by preventing disease and injury, promoting healthy behavior, and reducing the incidence of chronic diseases and conditions. So this is why public health system is a critical part of any healthcare reform. Each community in Colorado needs to provide high quality public health services regardless of its location. So these are our responsibilities as a local public health agency. We complete a community health assessment which we did this last year that we're putting together that we will present to you guys at the next Board of Health meeting. And that has to be done every 5 years. Advise the local Board of Health on public policy issues in order to protect the public, and provide or arrange for the provision of quality core public health services as defined by a Colorado Board of Health. So then these are the Board of Health responsibilities: selecting the public health director, act in advisory capacity to the public health director on all matters pertaining to public health, approve the 5-year local public health plan and then submit to the State Board of Health for review, request director or another to serve as board secretary, follow orders, rules, and standards of the Colorado Board of Health, and then holding these regular meetings, which are supposed to be every 3 months. And then these are my responsibilities as the public health director. Select all personnel required by the agency and prescribe the duties, serve as secretary to the Board of Health, and administer and enforce public health laws of the state, and then also the orders, rules, and standards of the state department, commissions, or Board of Health. Act as the local registrar of vital statistics or contracts of responsibilities, direct the completion of a community health assessment and public health plan every 5 years, and issues orders and adopts rules consistent with the laws, rules, and orders of the state and the state board in the event of a public health emergency. So this would be like quarantine, isolation, water boil, evacuation, or closure of a public place. So now I want to go into reproductive health and how that has changed within our community. I've done a lot of research on the Title X funding, and I don't personally think it's the right choice for our county. So we have come up with a different solution, which is BC for You. So this provides people 24 years and younger with free educational resources, birth control solutions, and sexual health services. So they provide us with supplies for the telehealth visits, which would be iPads and the stands that they need and things like that. And then they actually have a provider that comes to Rio Blanco twice a month, once to Meeker and once to Rangeley. And they actually pay us for use of our space and equipment, administration time, and nursing time. And I can go over those numbers with you if you'd like. And then we provide general supplies like alcohol swabs, iodine, things like that. So there was a TB exposure in Denver that I just wanted to make you guys aware of. On March 17th, we received information from CDPHE of a TB exposure at George Washington High School in Denver. CDPHE identified a person with active pulmonary tuberculosis disease who spent significant time at the high school. The individual was confirmed to have TB early in March, and health departments in Denver public health schools are conducting contact investigation right now. This is just some information about TB. So TB is caused by the bacterium Mycobacterium tuberculosis. It is most commonly in the lungs, but it can attack any part of the body. 2 TB conditions exist. So there's latent TB, and then there's also TB disease. So people with latent TB may not become sick, and they cannot spread TB to others. But if they do have TB disease, it is highly contagious, and it can be fatal. So some symptoms: cough, chest pain, coughing up blood, weakness, weight loss, fever, chills, sweating at night. Treatment is usually a 4 to 9 month course of antibiotics. So this is just an example of a public health emergency that our agency would need to step in and be directly involved with. And then also the TV numbers across the state, unfortunately, are increasing right now. So just an overview of future plans. We would like to apply for mental health specific grants that would benefit Rio Blanco County. I am not providing the COVID-19 vaccination for any children. I'm referring them to their pediatrician. We will be providing mental health first aid classes to all of you guys if you would like to take it, and also to the community. And then we're also working on our emergency preparedness and response document. Any questions?
I have a question on, as far as the, Title 10, was that the one through the that we coordinated with the hospital on to do, male sterilization and
It
those
was, yeah.
different things? Okay.
And you're contracting that now with somebody else? Or we're still doing it through the home?
No, we're not doing it at all. So we don't have family planning at all right now. So that's why, the BC for You, it's not grant funding, so we don't need to apply for any kind of grant. It's a service that they provide to every community in Colorado.
Do they do the, like, if someone wanted male sterilization or the implant, birth control thing, they'll
Yep.
provide those?
Yep. I'm not sure about the male sterilization. I think that would have to be contracted out. But they do the implants, the IUDs. They come once a month to Meeker and Rangeley, and they would do those in each respective clinic.
June, is it being utilized? I mean, is that program being utilized?
We don't have a contract in place right now, so that's really what I would like to do, is to get a contract in place with them so that we can offer those services again to the community. But not through Title 10 or family planning. I don't want to call it family planning. I'd rather call it like reproductive health. I think that's more appropriate.
In that contract, it would we'd be a vendor, right? Rather than,
Mhm.
yeah, so that would be a vendor contract. So they would come in and provide, and we provide support with it, and then they would pay as a vendor, to the county, to the public health.
Yeah. Yeah, so they would pay me for my nursing time that I would have to be there for the half day that they were there.
Any feedback for that, or?
I just need you to say that it's okay that I, that I do the contract.
I'm okay with it.
Oh, yeah.
Okay. Awesome.
It's a way better option than Title 10, I would say.
Mhm.
Title 10,
Yeah. Yep.
yeah, I won't go into that, but I just don't think it's,
Yeah, we gave up Title 10 last year. So we had it for a long time, then we went away from it, and then we got it back for about maybe a year or 2 years, and then we went away from it again. So,
Can you give me a quick synopsis of what that is?
so it's a grant that we have to apply for and we get money, but because Rio Blanco is so small, we actually weren't getting very much funding for it to cover the actual services that they were providing.
What are those?
So, sterilization, birth control, like reproductive health education, mainly birth control, I would say, is the big part of it.
And when we had a contract with somebody to Vaxed, I can't even say it. now.
Vasectomy?
Yeah, that's so painful word. No. That and things like that. So we didn't. I don't know how much we actually spent on
I
that.
don't know that we ever spent anything on it.
not
Where?
on that contract, no.
But we have those type of contracts with providers.
There's a lot of paperwork and administration that goes along with the Title 10, that never really was paid for. And so that, just administering that program and that grant took a lot of county time that you never saw anything, coming back from it. So
There was another one, the 403 or 403B drug program.
340B.
What is that? That one's the drug program, right? Where that we get, like, does anyone ever utilize that? Are we still doing that?
It was tied directly with Title X, that's how we,
Oh, okay.
control.
Gotcha, okay.
Yeah, and from my understanding, the Title X funding was very close-knit with Planned Parenthood. So I'm trying to get,
Appreciate that.
On the mental health grant you were talking about, like,
Yeah.
what specifically could you guys, what kind of grants are you looking at?
so there is a suicide prevention grant that I have been looking at. I don't know the ins and outs of it, honestly, but I'm open to, we're just researching at this
Okay.
point. I'm open to whatever we can find and think that would fit Rio Blanco County.
In your emergency preparedness plans, are you updating all of them? I'm trying to find them because I know we used to have those as an appendix to the county EOP. So I know there was influenza, I don't know, I'll find them. But
No, they will be part of that. We'll do, the public health will do them, get them finalized for public health, and then turn them over to Eddie, and he'll include them in the county EOP. And one of the things, we've got a plan, but they changed the statutes on us so much that we have to go back and redo a lot of it, so. That's one of
And
the,
Eddie's looking at updating the EOP, I think,
Mhm.
next year. So he'll have but he wants to, I think, get a contractor, consultant to do that, right?
Yeah, I think we've got to update the hazard mitigation plan and the EOP. So I think, and the community wildfire
CWPP.
protection plan. So I
Which-
think we're,
I've got an RFP for the CWPP for the perfect community, so he's gonna put that out to bid. And then you'll probably have that on your maybe May, contracts to look at.
And then also I wanted to remind you guys that the opioid settlement funding for the, I think it's 5 different counties, is due. I just had a meeting about this. And you guys have to accept that we would like to be a part of it.
we already have.
Oh, you already have? Oh, okay. Okay. All right, you guys are way
And
ahead of
on
me.
the opioid.
I'm the opioid coordinator. So.
Oh, okay. Okay, I didn't know that. All right, sounds good. Do you guys have any other questions about public health or for me?
Why did you think that we needed to go through the psychiatric stuff?
No comment. Yeah, I hope that you guys are okay with me not giving the COVID vaccine to children. I really don't feel comfortable with it. I don't like the COVID vaccine as a whole. I'm just gonna put that out there into the public. So especially for pediatrics, I don't wanna do that.
I support you.
I do too. Yeah,
Okay.
I think sending them to their pediatrician and
Mhm.
that can be their choice.
It's the parent's choice, and
Yeah. And I'm not, yeah. I won't get into
maybe
it
get
too much,
involved
but-
in that.
Okay, well, great. Thank you guys very much.
Can you share that slide presentation with me?
Yeah, absolutely. Yep, I'll send it to you.
Kind of dense sometimes, I need to refresh myself.
So the next meeting should be June, unless you want to do it earlier in Meeker, right?
Yeah, so June or July, yeah.
June or July.
Mhm. Do I just get with you to
Yep,
set
just
that
send
up?
me an email when you're ready to do it. Now, remember,
Okay.
the commissioners meet, the second Tuesday of the month in Meeker, and then the fourth one is here in Rangeley, so we
Okay.
just need to kind of, you know,
I'll
bump
try
that
to
whichever way.
coordinate that with you to
Mhm.
get
Yep,
it in
just send
Meeker.
me and let me know, and I'll make sure it's on there.
Okay, great. Is there anything else that you guys want me to talk about at the next meeting, or anything that you want me to address more at the meeting that you can, or if you think of anything, just let me know.
We will. Thank you.
Thank you.
Thank you, ladies, for
Thanks, guys.
coming.
Thank you, I appreciate
Thank you.
the presentation.
Beth wants to talk, I could sit on her face.
Beth,
She
come
wants
on,
to say
Beth.
something.
Thank you for the offer, though.
All righty, so we will adjourn, the Rio Blanco County Board of Health at 12:36. And then we are gonna go back into executive
Executive
session.